Welcome back to What's the 411 News, where we bring you news observation, interpretation, and news commentary from an FBA and BGR perspective. Let's get it. Welcome, everybody. Welcome back to What's the 411 News. And you see it on the screen. Tuberculosis cases are rising in New York City all of a sudden. All right. And I think you understand why. And we're going to break it down and let you guys know why this is going down, or the possibilities of why this is going down. All right. So, yeah, with Biden allowing pretty much the illegals, the illegal aliens, the undocumented illegal aliens, allowing them to just come on in. All right. And flood the cities, because to them, a lot of them, they looking at the U.S. To them, the U.S. is New York City. Most of them. That's the United States to them. So they've been flooding New York City. And we already reported that they're going into, they're overcrowding the hospitals. They're overwhelming the hospitals. And a lot of Black Americans that live in the city, they have to be in the waiting line. All right. And so they're flooding hospitals, medical centers. And now, for some reason, cases of tuberculosis have gone up. So they say, right? So let's get into it, man, and break this thing down here, all right? Let's break it down. So, again, tuberculosis cases rise in New York City, all right? There has been a significant, this is what we know, there's been a significant increase in tuberculosis or TB cases in New York City. It's a bit concerning because TB is a highly contagious airborne disease. All right. Highly contagious airborne disease. Y'all give me a minute here. Just give me a second. All right. So what's causing the surge? All right. What's causing the surge? It's looking like a big factor for the surge in TB cases is due to a large number of undocumented illegal aliens coming to New York City from countries where TB or tuberculosis is more common. Unfortunately, the New York City Department of Health and Mental Hygiene is understaffed and struggling to handle the increase in cases. Budget cuts and clinic closures have made it even more challenging to provide testing and care for TB. All right. So why are Black Americans and other Americans at risk? Excuse me. Black Americans and other Americans are at risk of developing TB because the infection can spread quickly in crowded places. This is a concern because New York City is a city with many people living close together or in close quarters. The long waits for treatment, like I mentioned earlier, the long waits for treatment at city-run TB clinics are also worrying, since it appears that undocumented illegal aliens are overwhelming hospitals and medical centers. All right. So how can you prevent TB? Preventing tuberculosis is important. So here are a few things you can possibly do. All right. So if you know if you are at risk, know if you are at risk already. Okay. That's a starter. Know if you are at risk. If you have a weak immune system, live with someone with active TB, live in a crowded space, or travel to places where tuberculosis is common, you should be extra cautious. All right. Lead a healthy lifestyle. Eating well, exercising, getting enough sleep, and practicing good personal hygiene can help keep you healthy and reduce the risk of TB. Get tested early. If you have been exposed to someone with tuberculosis, it's essential to get tested. Early detection can make a big difference in treatment. I would even say, even if you don't know, because you might not always know who's got what, this might be something you probably want to consider taking a test for. All right. Avoid spreading TB. If you have active tuberculosis, stay home and avoid having visitors until you are no longer infectious. Make sure your home has good ventilation and practice cough etiquette. It's also crucial to finish the full course of medication prescribed by your doctor to prevent drug-resistant strains of tuberculosis. Remember, taking care of your health and following these preventive measures can help you and others stay safe from tuberculosis. All right. So stay informed and also stay healthy. All right. So you guys let me know what you think about this one. It's getting crazy, and it seems to be like a back and forth type of thing when it comes to Biden. All of a sudden, we kind of talked about this before, he's letting everybody in, but then now backtracking and trying to make it look as though he's being tough on the borders. Right? So it's like a form of double speak without double speaking. You know what I mean? And so, yeah, this is crazy, man. Everybody in New York, Black Americans in particular, you need to give that city government some work. And we ain't talking about physical work, but you need to give them some work and, start acting like the folks in Chicago. They about had it up to here with it. And looks like sooner or later, something's going to be about, something's going to blow up in Chicago because it's getting crazy. So New York, you need to follow suit. All right. So yeah, ladies and gentlemen, let me know what you think about this one. If you are living in New York, comment, put something in the comments. Maybe later on we'll bring you on if you would like to talk with us. All right. So with that being said, no matter where you are around the world, you can always bet on the new Black media. This is What's the 411 News, and we out of here. Peace. Welcome back to What's the 411 News, where we bring you news observation, interpretation, and news commentary from an FBA and BGR perspective. Let's get it.